Alright guys, so we're gonna try and do my trach cleaning video. So I want to preface this by saying I don't have certain items, so I'm going to substitute them for the demonstration of this video. I'm also going to preface this by saying I don't have a bedside table, so the setup of my video won't be the same as in real life, because in real life you would have your sterile field, your sterile gloves, your drape, all that on a bedside table beside your patient's bed. You wouldn't have, your patient on your drape, so forth, so on, so you wouldn't be crossing your sterile field. I want to preface that by saying, I wanted to say that because I don't want it to seem like I know we're just going to be crossing over sterile fields. No, you would have it on a bedside table. I just don't have one, so I'm going to try and simulate as best I can. So let me move you real quick. I'm going to go ahead and verify our our doctor's orders. Doctors have a set time when they want you to clean it, what they want you to clean it with. We're going to gather our supplies. So for the purpose of this video, you need your trach cleaning kit, sterile saline, and peroxide. I don't have saline or peroxide, so we're going to simulate it. You're going to need your shield, which I have, and you're going to need a face mask and a gown. I don't have those two, so we're going to simulate that. We're going to identify our patient, name, date of birth with their wristband within our system, and then we're going to go ahead and don on some clean gloves. And this is when you would put on your PPE. I only have the face shield, so for the purpose of this video, we're going to say that I went ahead and put on a gown and a face mask. So I'm going to go ahead and put on my PPE. Now each patient has a sponge gauze that goes underneath their outer cannula against the skin. It looks like a 4x4 with a split, same as if you had a peg tube. We're going to go ahead and take it out, and we're going to look at it, look at the drainage. If it has a lot, we can put it in the bio bin. If it doesn't, we can put it in the trash. So I'm going to say mine doesn't have any, so I'm going to put it in the trash. We can also look at the site at this time and see if it has any signs of infection. So drainage, a smell, redness, and then we're going to go ahead and pre-oxygen our patient. So pre-oxygenation is 100% O2 for at least 30 seconds at least. So you can put a face mask over their site and have them breathe 5 to 6 deep breaths, or you can even use a manual resuscitation bag, 5-6 breaths. And then once you're done with the pre-oxygenation, take it and put it to the side of your patient, because you want them to get the blowback of the oxygen. We're going to remove our gloves, and we're going to perform hand hygiene. And now we have to get our sterile field ready. And so the outer side of your tray is dirty. The inside is clean, is sterile. So we're going to go ahead and open our field away from us. While I'm doing this, I want to once again preface I don't have a bedside table, so the dimensions of where you would lay stuff isn't the same, but I wanted to go ahead and say that just in case. So my tray's open. I opened it away from me. I can go ahead and grab the outer corner of my gloves. So I'm going to go ahead and grab that and set it to the side because I don't need it right now. Now my drape is sterile, but for the drapes as well as the package that the gloves come in, it has a 1-inch border around it that's dirty. So I'm going to grab the very corner and I'm going to pull it up and grab, it kind of just unfolds. Grab the other corner, and then you would put it on your bedside table. And you can use the corners to maneuver it however is necessary for your patient. So I'm actually going to pick my little tray up, and I'm going to move it for a second, going around my sterile, because I want to move this to try and simulate a bedside table. So we can say that this is my bedside table and this is my patient, and hopefully I won't get any marks taken for my setup. All right, so now I have to dump all my sterile stuff that's in here into my sterile field. So once again, the outside is dirty, so I'm just going to take the wrapper, put it to the back, and grab the outside sides like this. I'm going to dump it. Trying, there we go, to maintain sterility. And I'm going to set it to the side. So I can't touch anything in there because it's sterile. I do have to go ahead and, before I put on my sterile gloves, put my solutions into my little bin. So we have sterile saline and peroxide. So if they were open, you would check, see if it's open, and then you would lip it into a trash can. Always check the expiration date. I want to say mine haven't been opened. So I'm going to take my peroxide with the label to my palm, pour it in, and then set it outside of my sterile field. Take my sterile saline, label to palm, pour it in, and set it outside of my sterile field. So now I have my solutions, my sterile drape set up. Now I need to go ahead and put my sterile gloves on. So you can't touch the outer cuff of your sterile gloves. You can only touch the very, very inside corner of it, and that's just because once you have touched the inner, if you can see, the inner side of the cuff that touches your skin obviously isn't sterile. The outer part, like all of this, is sterile. So you can, once you have your gloves on, you can actually, and I'll show you, you can take your gloves and maneuver, because you're sterile on sterile right here. Just don't touch the inside cuffs. Go ahead and chunk that by grabbing the inside of your wrapper, because it's sterile on sterile. Over here, I can go ahead and maneuver, and once I have my sterile gloves on, I can touch the inner part of it because it's sterile on sterile. Alright, so now we have two Q-tips, two sponges to dry, two sponges to wash, my dressing, my brush, and a tie down. So I need to break sterility with my non-dominant hand to pull out my inner cannula. So I'm going to do that and put it in my solution, my sterile saline. Now in real life, your patient's outer cannula wouldn't pop out like that, but so with your inner cannula, you can put it in the peroxide if it has a lot of secretions. If it doesn't, you put it in the sterile saline. If you do put it in the peroxide, you have to put it back in the sterile saline. So keep in mind, this hand is now dirty, this hand is clean, so I put it in the sterile saline, and I switched it around. I'm going to take my brush, which is sterile, put it in the sterile saline, and you can put it, make sure never come in contact with your fingers. So brush, you can flip it around, brush the inside, if mine will go in. Doesn't want to, and I don't want to break sterility in this video. You can go in the inside, brush all of the outside, and then throw this away. And you can drop that back in the solution and swish it around. Now in my kit, I don't have pipe cleaners, but if I did, I could take a pipe cleaner. This is what you would use to dry with. Take a pipe cleaner, put one in the inside to dry it, take the other side, put it on the inside to dry it, toss it away, take another pipe cleaner and dry the outside. And now I can take my inner cannula and put it back into my outer cannula with my dirty non-dominant hand. And once again, your patient wouldn't be moving, but there you go. And I still haven't maintained sterility, so this hand won't be touching anything. This hand can. So you can take one of your little pads and form like a little squish. Like that. And you can test it on your dressing, your sterile border. You can put it in the sterile saline, and maintaining sterility and making sure your fingers never touch skin. That's why we did it in the squish. You're going to go ahead and clean outer and then toss it. You can do it again with the other one. And you're also going to clean with your Q-tips. Clean, outer, toss. So with your Q-tips in your sterile hand, what you do is, and with the same thing with the dressing that the squishes that I showed you, the 4x4s, your purpose is to go inner to outer. So you want to go with the inner part of your cannula, clean, and then toss it, get another one, swish it around, clean, and dump it. So the goal is to clean inner to outer, so the inner part of the stoma to outer, never going back in. So remember to clean with your Q-tips and your little dressing. So once you've done that, once you've cleaned inner to outer with your saline, maintaining sterility, now you have to dry it. So I'm going to take my sterile hand, keeping my non-sterile hand, my dirty hand, away from it. You can do another squish. And we're going to dry the same way we cleaned. So inner, toss, grab another one, and then you're going to clean, toss, and make sure that stays. So you can also kind of wrap the sterile gauze like around your finger if you wanted to, and then that way, you know, it's easier to go underneath the outer cannula without touching any part of your finger. And you can kind of use your non-dominant hand if you wished and lift up a wing, like, and stabilize it, like lift up a wing so that you can clean underneath your the outer cannula wings without breaking sterility. But make sure, you know, this hand can touch your patient and your outer cannula, but it can't touch anything else. And this hand can't touch that hand or your patient. It can only touch your sterile equipment. So now my patient's been cleaned, the site's been cleaned, the inner cannula's been cleaned. Now I have to break sterility because I have to put my dressing back on my patient. And at some point, we're going to have to touch skin. So you're going to take your patient, make sure that at least you try and keep the split as clean as possible. So we're going to go under our patient's trach, and we're going to at least try. There we go. There we go. So now we have our dressing change on. Our sterile field, like I said, is done. So the last step is to change our tie downs. So for the purpose of this video, I can't do it because mine's not set up this way, but the two biggest things are always tie in a slip knot, so it's easy to unattach the tie down if it was required. Also, never remove the old tie down before you remove the new tie down. So what you would do is you would take one hand and kind of stabilize the outer dressing, the outer cannula. You would take one end of your new tie down, tie it in a slip knot, and then kind of pull it around the patient's head. And then you could at this point go ahead and tie down your new tie down over here with a slip knot. And once you have your new tie down set, then you can remove your old tie down. So remove your old tie down, and now you have your patient with a new tie down, and their site's been cleaned, their stoma's been cleaned. And you can remove your gloves and perform hand hygiene. You can also and you're going to go ahead and document the procedure, how the patient handled it, and any description of the secretions, like how they looked, signs of infection, the amount. And that is my video.